Edith Piaf, a French singer, well known for her beautiful voice and iconic songs. In her early 30s, she felt so much pain in hip joints and was referred to a doctor. Later, she was diagnosed with rheumatoid arthritis, an autoimmune disorder that affects joints, causing pain, stiffness, and swelling. With not much treatment options at the time, she was prescribed and became addicted to painkillers. She also continued to self-medicate with alcohol. This toxic combination took a toll on her health, and she died of liver failure in 1963.
This is really sad.
Yes, but though it wasn't about the disease, it was about how it was dealt with. Rheumatoid arthritis is one of the most famous connective tissue disorders. Now, considering that you are living under a rock and by now you don't know what a connective tissue is, well, let me tell you. A tissue is a group of cells, and a connective tissue is one of the four basic animal tissues, along with epithelial, muscle, and nervous tissue. You have got connective tissue pretty much everywhere in your body. Your skin is mostly connective tissue. Bones and blood vessels are types of connective tissue. Tendons,
Connective tissue.
ligaments, well, you guessed it, connective tissue. Surprising, isn't it? By the collagen and elastin on it, connective tissue provides support to the organs. It binds bones and other tissues to each other. The reason your organs doesn't fall when you stand upside down is that it's connected to each other by connective tissue. So, what could possibly happen if a connective tissue in our bodies got inflamed? Not a very pleasant event, which is a connective tissue disorder. Connective tissue disorders could be either autoimmune or inherited. Let's start by talking about autoimmune diseases. Normally and naturally, our immune system tends to protect us from diseases and infections. But if you have an autoimmune disease, your immune system starts attacking your own healthy cells.
Even my immune system wants to attack me.
The cause of autoimmune disorders is still unknown, but though it could be running in the family, and it usually affects women more than men. Diseases like ankylosing spondylitis, inflammatory disease that can over time cause small bones in your spine to fuse, and this fusing makes the spine less flexible, resulting in a hunched forward back. Early symptoms usually are pain and stiffness in lower back and hips that increases in the morning. Painful neck and fatigue are also common. And rheumatoid arthritis, in which the immune cells usually attack the membrane around the joints, but could attack the skin and lungs as well. Symptoms vary from one to another, depending on the severity of the condition, but commonly, a person with rheumatoid arthritis experiences joint pain, stiffness, tenderness, and often swelling, starting with the joints of the hands, wrists, and elbows in both sides of the body. Some early signs that means a person could be suffering from rheumatoid arthritis: increased fatigue, short breathing, present blood on stool, pain in chest, and constant feeling of sadness. In case you are lost, ankylosing spondylitis and rheumatoid arthritis both are examples of autoimmune connective tissue disorders. Till now, was that dark enough?
My life is darker.
Good then. Let's take a look at some inherited connective tissue disorders. Inherited autoimmune diseases are kinda rare. It results because of some changes in different genes in a person's body. Like Marfan syndrome, in which bones, ligaments, eyes, heart, and blood vessels are affected. People with Marfan syndrome tend to be tall and thin. And I mean very tall and thin. They have extremely long bones and spider-like fingers and toes. They suffer from extreme nearsightedness and backflow of blood into the heart because the valve isn't closing properly, and this is due to the genetic problems. Other inherited disease is polymyositis and dermatomyositis. They are both related diseases. Polymyositis is marked by an inflammation in muscles, and dermatomyositis is an inflammation in skin. They both cause swelling and tenderness in both muscles and skin. This disease causes so much weakness in the arms and legs.
Before I cut my non-existing wrist, Can you tell me there's treatment for those diseases?
Well, that's a bit tricky because there is no complete treatment for connective tissue disorders till now. But treatment and medications, such as beta blockers, which is used with Marfan syndrome patients to prevent damage to their hearts, and the other drugs used under doctor prescription for sure, tend to reduce the severity of symptoms and pain. Though, early diagnosis of any of these disorders followed by an early physical therapy interventions result in an improvement in the patient's current condition and prevention of any further complications. Therefore, provide patients with an optimal quality of life. A physical therapist uses isometric, dynamic, and isokinetic methods for gradually strengthening muscles. Also, massage therapy techniques, including pressure and needling, are recommended for stiff joints. Mobilization is also utilized according to pain intensity and muscle strength. The right posture for the hips, knees, ankles, shoulders, elbows, and wrists are recommended at the end of a rehabilitation session to avoid increasing pain at home. And at the end of this video, if you have noticed any of the symptoms mentioned earlier in your loved ones, make sure to visit the doctor as fast as possible to ensure yourself. And always remember, early interventions make best results. And if you are interested for more detailed information, take a look at the references down below. Bye!